Olivier Jacques is a professor of public health at the University of Montreal, and he is joining us now to discuss the CAQ's Bill 7. Now, if you've lost track of all the bills, because there are so many bills going on, that is the bill from the Treasury Board President, France-Hélène Duranceau, to merge or abolish some of the health agencies. And it's all supposed to save the government $35 million by cutting 220 full-time positions, 100 of them in the healthcare system, okay? But some healthcare experts and public health experts are sounding the alarm that this may not be the way to go. Olivier Jacques, Professor Jacques, thank you so much for joining us.
Thanks for having me.
It's a tough one to summarize, and there are so many heated discussions about so many different bills that the CAQ is throwing our way. But this one people really need to know about because cost cutting is one thing, but if it's at the cost of health services, it becomes a problem. So first, take us through why we need to care about Bill 7.
Yeah, you're right that there's so many bills, and this one is not like the most obvious to talk about, and it's not the most publicized, but it is also very important. So indeed, it tries to save $35 million, but with all the merging that it does. So it merges the public health agency, the Institut National de Santé Publique, with an institute called the Institut National d'Excellence en Services Sociaux, which is about basically, it will, for instance, like test whether or not a new drug should be covered by public insurance by looking at cost ratio analysis, et cetera, cost-benefit analysis. So this is one of the parts that the bill does, but it also removes, for instance, some other institution that won't exist anymore. So, for instance, the Conseil québécois de l'assurance parentale, which is basically an advisory board about the parental insurance in Quebec. So it does many things at the same time. But here, I think we want to focus on the public health aspect of it.
Well, yes, because as you know, we're in a health crisis. The doctors are screaming on the street. They're threatening to leave the province. Services are being cut left and right. Most people don't have a primary care doctor. It's impossible to find a pediatrician, and the list goes on and on. So when we hear that the government is saying, oh, wait, let's reduce by sort of mashing some things together, the question is was it broken in the first? Why are we fixing something? Was it in your mind's eye, the way it was set up before all these mergers, did it need this transition?
No, exactly. So that's these two institutions are not one of the problems of our healthcare system, and there are several problems, but this is not one. And indeed, in the Parliamentary Commission last week, we argued, me and my colleagues from my department at the School of Public Health, we argued that there's no problem; it should not be fixed. In the sense that the ENSPQ has been created about 30 years ago. So this is the public health agency. It regroups together all the functions of public health. So research, vaccination, laboratories, and also health promotion activities all together with all the experts together. And this is a model that has been copied all over the country afterwards. So the Public Health Agency of Canada has been modeled after the Quebec ENSPQ. And so this is just something that works. And Ines at the same time is also doing a great job in trying to find more cost-effective technologies within the healthcare system. And so it's not clear to me what the goal is by merging these two institutions.
But what will it mean for the day-to-day? Because you will not believe me, but I was just having a conversation with some family members who are doctors, and we were discussing how the public health sector and the public health sector researchers and the workers, you're the sort of unsung heroes, right? It's not very glamorous when you say public health, but the work that you do, people don't realize that it's this huge umbrella that takes care of all of us, right? And so if you're going to be merging all of these things together, what will this mean for the day-to-day of how the services will be distributed and our access to services?
Yeah. First of all, I must say I'm not a hero. I'm just a political scientist actually working for a school of public health. And so these guys are actually doing the public health research. I'm here to talk about, public policy issues. And I think that, people won't see the difference in their day-to-day lives. This is not like Bill 2 that will make some huge changes in healthcare. But, the issue is that it may well very much lead to a significant reduction of public health budgets in the future. Because public health is about trying to make sure that we improve the health of the overall population over the long term.
Right.
And so this is important because, you may not notice it, but at some point you will be healthier because we managed to convince you not to smoke, for instance.
Right.
And so this is impacts on the overall population health, but also on the overall cost of healthcare. Because we know that investing in public health reduces the burden of disease and therefore reduces costs for the healthcare system in the future. So this decision, if it leads to lower public health budgets, it may create problems down the line.
And is the sense in the public health community that that's sort of what's about to happen? But as you said, I guess in your sector, it's slow, right? It'll be a trickle effect for the rest of us.
Yeah. So I mean, the budget doesn't reduce investments in public health, but we know already that if there's an within an institution, there's a budget to allocate. And so you need to decide where to put the money. And obviously there are some crises in the healthcare system right now. So the money will be put towards the curative functions of the new institutions that are closer to the INES, the institution about the excellence in health and social services. And so, for instance, to know what should we do to solve an immediate crisis in the healthcare system. And so we are afraid that if the public health agency that is merged with another institution that is much more oriented towards short-term problems, we are afraid that this public health agency is going to lose the budgets because the people within the new institute will probably put the budgets towards more short-term crises, and that will be limiting the budgets invested in public health that has long-term effects.
Yeah, you don't want to have competing goals in that
Exactly.
sense, because if the budget has to be used and someone says, well, I need it now, and you're saying, but hold on, we need it long-term, this is where we come into some problems. Olivier Jacques is a professor of public health at the Université de Montréal. Thank you so much for taking the time.
Unmistakably Canadian.
It's the music that raised you.
The artists raising the bar.
Hi, this is Brian Adams.
Hey, my name's Brett Emmons. I'm from the Glorious Sons.
Hi, I'm Nelly Furtado.
Made in Canada. The station that champions Canadian music.
Loud, proud, and all yours.
No passports required. Just press play.
Tap into Made in Canada now on iHeartRadio.ca
Or the free iHeartRadio app.